Navigating a new diagnosis of multiple myeloma, wow, it can feel completely overwhelming. So today, what we're going to do is lay out a clear, simple roadmap for the treatment journey that's ahead. Think of this as your guide to understanding the path step by step.
And it's so important to start from a place of hope. The fact is, there are more effective options available today than at any other point in history. That is a really powerful place to start this journey.
Okay, so here's our roadmap. It's got 5 key stages. We'll kick things off with the treatment goals. Then we'll get into your first therapy, called induction. After that, we hit the transplant decision, the transplant process itself, and then finally, recovery and the road home.
Any good journey starts with a destination in mind, right? Well, in myeloma treatment, that means we need to understand exactly what the therapy is trying to accomplish.
So what are we aiming for here? Well, it's a few different things. On a clinical level, it's about knocking those M protein and light chain numbers down and getting rid of myeloma cells in the bone marrow. But on a human level, it's all about improving your quality of life, giving you the longest possible time in remission, and ultimately prolonging your life. It's about feeling better for longer. Simple as that.
All right, let's talk about the first active step in your treatment. This is called induction therapy. The whole goal here is to get the myeloma under control and to do it quickly and effectively. And we usually do that by using a combination of drugs that attack the cancer cells from different angles.
So, induction therapy is almost always a combo of drugs. The simplest version is what we call a doublet, just 2 medicines. This might be an option when managing side effects is the absolute top priority for someone.
More often, though, you're going to hear about a triplet regimen. This is a combination of 3 different drugs, and it's a super powerful and very common standard of care for newly diagnosed patients. It really offers a great balance of effectiveness.
And then you've got the quad regimen. We're talking 4 drugs here. This is a newer and incredibly effective approach that is fast becoming a standard of care, mainly because of the really deep responses it can achieve.
So this really lays out the core trade-off. It's a balancing act. On one hand, you have triplets. There's the proven, highly effective standard. On the other hand, quads are the newer approach, and they can offer an even deeper response, meaning they knock the myeloma back even further, but that might come with a higher risk of side effects. This is such a critical conversation to have with your doctor to figure out which approach is the right one for you.
Okay, so after that initial induction therapy, you arrive at a major fork in the road on your treatment map, the big decision about whether or not to have a stem cell transplant. And the very first question that you and your doctor need to answer is this one. Are you a candidate? An autologous stem cell transplant, or ASCT for short, is a standard treatment, but it's not for everybody.
Now, eligibility isn't just about how old you are. It's a much bigger picture. Doctors are going to look at your overall fitness, any other health conditions you might have, your activity level, and of course, what you want. Your personal preferences matter a ton. Plus, different cancer centers might have slightly different guidelines. The bottom line is, it's a whole person assessment of your health.
So, if you and your doctor decide to go for it, the next part of the map gets into the details of the transplant itself. And don't worry, we're going to break this whole thing down into clear, manageable stages.
So, from a bird's eye view, the process looks like this. It starts with that induction therapy we just talked about. Then, your own stem cells are collected and frozen. Next up is high-dose chemotherapy, and that's followed by putting those thawed stem cells back in. Finally, there's the period of engraftment and recovery, where those new cells get to work.
And to kind of put this on a calendar, the stem cell collection usually happens a few weeks before the main event. The day you get your cells back is called day 0. The next 2 weeks or so are all about waiting for those cells to engraft. That just means to take hold. And then the first 100 days are a really critical time of early recovery and very close monitoring.
Okay, so that's the big picture, but what does it actually feel like? What are the key moments you're going to experience during the transplant? Let's zoom in a little closer.
So the first major step is something called conditioning. This is where the high-dose chemo comes in. And the goal here is really twofold. 1, to wipe out as many of the remaining myeloma cells as possible. And 2, to make space in your bone marrow so the new, healthy stem cells have room to grow.
Then comes day 0, the infusion. And honestly, this part is pretty straightforward. Your own stem cells, the ones collected weeks earlier, are thawed out and then they're just infused back into your bloodstream through an IV. It's a lot like getting a normal blood transfusion. And the amazing part is, these smart cells know exactly where to go to set up their new home in your bone marrow. After the intensity of the transplant, the map leads us to the final and maybe the most important part of this journey,
recovery, and the road home.
So life right after a transplant requires some adjustments. The high-dose chemo basically wipes out your old immune system, so your new one needs time to build itself back up. That means you'll be more vulnerable to infections for a while, so good hygiene is absolutely crucial. You'll also be watched like a hawk by your care team to track your progress and catch any little issues early. It's a time for careful rest and recovery. And then, once you're through this initial phase, the conversation will likely turn to the next step, usually a long-term, lower-dose maintenance therapy that's designed to keep the myeloma in remission for as long as possible.
Look, this entire roadmap is designed to empower you with knowledge, because the most important person on this journey is you. You are the absolute center of your care team. So, as you look at this map and you think about your own journey, what's the first question you're going to ask your doctor?